Hello, welcome to Brainetainment, your one-stop channel for easy-to-understand yet informative content. Here we transform complex information into bite-sized knowledge nuggets. Pneumonia, a term you might have heard before, but what exactly is it? Pneumonia is not just one disease, but a group of illnesses that have one thing in common. They all cause an inflammation in the lungs. This inflammation is usually due to an infection, caused by a variety of organisms, including bacteria, viruses, and fungi. Now imagine your lungs. They're made up of small sacs called alveoli, which are responsible for the exchange of oxygen and carbon dioxide. When you have pneumonia, these alveoli get filled with fluid or pus, making it harder for your body to take in the oxygen it needs and expel carbon dioxide. This can lead to a host of symptoms such as coughing, fever, and difficulty breathing. Pneumonia can affect one or both lungs and varies in severity. In mild cases, it's similar to a bad cold or flu, but in severe cases it can be life-threatening, particularly for those with a weakened immune system, such as the elderly or people with chronic illnesses. It's also worth noting that pneumonia does not only affect humans, but also animals. It's a common disease in many species, including dogs, cats, and even birds. So in essence, pneumonia is a lung infection that can seriously hinder the body's ability to breathe in oxygen and breathe out carbon dioxide, potentially leading to serious health complications. Now that we know what pneumonia is, let's explore what causes it. Pneumonia isn't just a random occurrence, it has specific causes. Let's delve into these causes so we can better understand this condition and how it affects us. First and foremost, pneumonia is typically triggered by an infection. This infection can come from various sources, the most common being bacteria. The chief bacterial culprit is Streptococcus pneumoniae. It's a bit of a tongue twister, isn't it? But this microbe is no laughing matter. It can invade your lungs when your immune system is weakened, say, by another illness or by a compromised immune system due to age or chronic disease. Next up, we have viruses. Common ones include the influenza virus, which gives us the flu, and the respiratory syncytial virus, or RSV, which is particularly risky for young children. And let's not forget the infamous coronavirus, which, as we all know, has had a significant impact worldwide. Fungi, while less common, can also lead to pneumonia, especially in people with weakened immune systems or chronic diseases. Certain types of fungi found in soil or bird droppings, for instance, can be inhaled and cause infection. Now, it's crucial to remember that these pathogens don't always result in pneumonia. They can lead to a variety of respiratory infections. It's when these infections progress and affect the air sacs in your lungs, filling them with fluid or pus, that we're dealing with pneumonia. Pneumonia can also be caused by aspiration, which happens when you inhale food, drink, vomit, or saliva into your lungs. This is more common in people who have difficulty swallowing or coughing, perhaps due to a neurological condition or excessive alcohol consumption. Lastly, certain health conditions and lifestyle factors increase the risk of pneumonia. These include chronic lung diseases like COPD or asthma, smoking, hospitalization, especially in intensive care units, and having a weakened immune system due to illness or certain medications. Understanding the causes aids in prevention, but how would you know if you have pneumonia? By knowing the symptoms. Stay tuned as we explore these symptoms in the next scene. Recognizing pneumonia can be tricky, but there are telltale symptoms to look out for. Pneumonia, as we've learned, is an infection in the lungs, and its symptoms often mimic those of a common cold or flu, but with a few key differences. One of the most common symptoms is a cough. However, unlike a normal cough, a pneumonia cough is often accompanied by green, yellow, or even bloody mucus. It's not the most pleasant image, but it's a key sign that something isn't quite right. Next, you might experience a fever, which is your body's way of fighting off the infection. This fever can be mild or quite high and is often accompanied by chills or sweating. Feeling short of breath? This is another symptom of pneumonia. The infection in your lungs can make it difficult to breathe, especially if you're doing something active. You might also notice a rapid heartbeat, another sign that your body is working overtime to fight off the infection. Chest pain is another common symptom of pneumonia. This pain typically gets worse when you cough or breathe deeply. It's your lungs' way of telling you they're not happy. Feeling unusually tired or weak is another symptom to watch out for. Pneumonia can take a lot out of you, and you might find yourself needing to rest more than usual. Lastly, older adults and people with weakened immune systems might experience confusion or changes in mental awareness. This is because pneumonia can affect the oxygen levels in your blood, which in turn can affect your brain. And let's not forget our little ones. In children, symptoms may not be as clear. They might seem lethargic, have difficulty feeding, or exhibit a bluish color in their skin, especially around the lips and nails. If you or someone else exhibit these symptoms, it's important to get medical help. But what does treatment look like? Pneumonia can be a serious condition, but with proper treatment, it can be managed. When it comes to managing pneumonia, the course of treatment often depends on the type and severity of the condition, as well as the overall health of the individual. Commonly, antibiotics are the first line of defense, especially when dealing with bacterial pneumonia. It's crucial to take these antibiotics as prescribed by your healthcare provider. Don't skip doses and don't stop taking the medicine just because you're feeling better. The infection could still be present and could bounce back with a vengeance. In addition to antibiotics, the treatment plan often includes rest. Rest is a powerful tool in the healing process, as it allows the body to use its energy to fight off the infection. So, if you or someone you know is battling pneumonia, encourage them to take it easy and get plenty of sleep. Hydration is another key aspect of the treatment process. Drinking fluids, especially water, helps to loosen the mucus in the lungs, making it easier to cough up. This not only helps to relieve the symptoms, but also speeds up the recovery process. In more severe cases, hospitalization may be necessary. This is especially true for older adults, people with other serious health conditions, and those experiencing severe symptoms like difficulty breathing. In the hospital, treatments may include intravenous antibiotics, oxygen therapy, and possibly even respiratory therapy. In essence, the treatment of pneumonia encompasses a multifaceted approach that combines medication, rest, and hydration. And while these treatments can effectively manage the condition, it's important to remember that not all cases of pneumonia are preventable. However, you can reduce your risk by practicing good hygiene, staying up to date with vaccinations, and maintaining a healthy lifestyle. This includes regular exercise, a balanced diet, and avoiding smoking or exposure to secondhand smoke. Proper treatment can save lives, but prevention is always better than cure. So let's take care of our lungs and stay healthy. Preventing pneumonia can be as simple as following a few guidelines. Firstly, consider vaccination. Vaccines are a powerful tool in the fight against pneumonia, especially for those at high risk such as young children, the elderly, and people with chronic health conditions. Vaccines like the pneumococcal vaccine and the flu vaccine can provide protection against the most common types of pneumonia. Next, good hygiene is paramount. Regular hand washing with soap and hot water or using hand sanitizers can reduce your exposure to bacteria and viruses, including those that can cause pneumonia. Cover your mouth and nose when you cough or sneeze to prevent the spread of germs. Regularly clean high-touch surfaces to eliminate potential sources of infection. A healthy lifestyle is another key to prevention. Regular exercise, a balanced diet, and adequate sleep can boost your immune system, making you less susceptible to pneumonia. Avoid smoking, as it can damage your lungs and make them more susceptible to infections. Limit alcohol consumption too, as it can also weaken your immune system. In summary, pneumonia is a serious lung infection that can be life-threatening, especially for the high-risk groups. It can be caused by various microorganisms, including bacteria, viruses, and fungi. Symptoms may range from mild to severe, including cough, fever, difficulty breathing, and chest pain. Treatment generally involves antibiotics, rest, and fluids, but severe cases may require hospitalization. Prevention is always better than cure. Vaccination, good hygiene, and a healthy lifestyle are your best defenses against pneumonia. And remember, if you experience any symptoms, seek medical attention promptly. In the end, it's all about arming yourself with knowledge and taking proactive steps to protect your health. We've covered a lot today about pneumonia, from its causes and symptoms to its treatment and prevention. It's our hope that this information proves useful and prompts you to take action where necessary. Remember, knowledge is power. Stay informed, stay healthy. Don't forget to subscribe to Braintainment for more enlightening content.